Hello, everyone. Welcome back. Today, I am very excited about my guest because if you've listened to the podcast, which my guest has, you know that I talk about the importance of mental health all the time and how I've wanted to have a psychiatrist on the podcast for literally years because you really can't have holistic health without having mental health. And there are so many, you know, intertwinements of mental health into exercise. And today I have Dr. Margaret Duncan on the podcast to talk about these things. She is an Evla member. She is a podcast listener. And she reached out to me because she heard me talking about, I really want to have somebody on the podcast to talk about these things. And she was like, hi, I'm her. I can talk about all these things. So Dr. Margaret Duncan, just a quick little introduction. She is a psychiatrist. She's a writer. She writes almost daily on her Substack. It's called Bad Art Every Day. She also is the host of a podcast called How to Be Patient, which is a mental health podcast. And today we're going to talk about body image and how to improve your body image and her lens on body image as a psychiatrist, and then disordered eating and disordered exercise and how to kind of identify those things using exercise as therapy, all things that I think, I kind of see some of this stuff maybe as a spectrum, and that's what I want to talk to you about today. So, welcome.
Thank you so much. I'm so excited to be here and talk about these topics. That is why I went into psychiatry, as well as an Evlo member and a huge fan of your work and the podcast. I'm so excited to be here as part of the community too.
Awesome. Well, I feel like it can be such a missing piece in the fitness world. So let's go right into body image. I want to start with body image, and then we'll kind of talk about disordered eating, disordered exercise. So first of all, what is normal body image? Does anyone really have a normal body image? And when we're looking through the lens, your lens as a psychiatrist and therapist, what does it mean to have a normal body image or maybe a disordered body image?
Yeah. So I think what you had just mentioned of things existing on a spectrum is really important as a concept in mental health and in psychiatry specifically. So when we think about normal body image, when we think about normal across the board for any mental health condition, whether it's anxiety disorder, depression, and body image or body dysmorphic disorder, we're thinking about it from a level of function. So our diagnostic manual, the DSM-5, it's the fifth, the current version we're on, defines basically any illness as something that is consistently disruptive to someone's functioning across different life domains. So we don't have, and this is one of my honestly beefs with like eating disorder and body image stuff, is we define pretty concretely the negative, but we don't describe like what is positive body image or what does flourishing look like in these domains of people's lives. We just try to avoid pathology. So for normal body image, functionally, it's going to be something where it doesn't get in the way of your day-to-day life. And so what that looks like, let's say if we exist on a spectrum where here is like really severe body dysmorphic disorder and really struggling with body image, all the way to never has thought about it, has just always looked in the mirror, love what they see, don't think about their body at all, right? This is a spectrum. This end of disorder would mean, multiple hours a day, often over weeks to months to years of someone's life where they're thinking about or how they appear to others, what is the perceived image that others are getting of them, and often how it's defined in the DSM, it's in negative terms, is they view something that is maybe a small, minor flaw, whatever, about their appearance, or not something that anyone would say is a flaw, and it becomes something that they're somewhat obsessed with and constantly think people are judging them over or find them disgusting. They're constantly trying to change it and or do kind of what we call checking behaviors in mental health. So maybe it's constantly looking in a mirror to make sure their nose is in the right light, or constantly looking up ways or thinking about ways to like change their, let's say they have like a wrinkle or something that they're like, everyone must notice this and think I look this way. So it's the volume of how much it takes up your day-to-day life. An example I'll give of something that I would say concretely, like what is normal, is maybe you put on a dress in like a fluorescent TJ Maxx like fitting room, and it's like not your size and you don't look good in it. And then maybe your brain briefly goes to like, I should eat better or do this, or like, oh, I wonder how I look in this. But then you take it off and you go to the dressing room and you don't really think about it for the rest of the day. Where all emotions are allowed, all thoughts are allowed. It's really the kind of intensity and frequency and how much they impact you that we think of as abnormal. So normal is like they're there, but they don't. I often tell my patients they're not very sticky thoughts. Like they don't feel like they're stuck to you and you can't move on from it, or you avoid things because you know once that you think that it's going to be kind of over for how you're feeling the rest of the day.
Yeah. I think that's a really good explanation. And I think that a lot of people could relate to having thoughts that might be considered abnormal. So I know that it's hard because you deal with probably a higher percentage of those people, but what percentage of women in our society do you think have these abnormal thoughts on a day-to-day basis?
So from the body dysmorphia literature that is like sort of the diagnosis version of this where people present for treatment, we think globally it's like a 2 to 3% of the world with a 60-40% split of women to men. But that is different than what you're talking about, which is how many women have thoughts like this, particularly how many women have thoughts like this. And it's getting in their way of their day-to-day life for a period of time. But maybe, first of all, we think body dysmorphic disorder is very underdiagnosed and under-recognized. But there's another term in the body image world and in the kind of feminist psychotherapy and women's mental health called normative female body dissatisfaction. Normative being common, not normal. Body dissatisfaction being this kind of stuff we're talking about, body image. And then female, as in it's more prevalent in this form in the female population, given an appearance focus. So we don't have a number for that. Anecdotally, I don't know, as someone with a lot of female friends, as someone who works in eating disorders with more of a female leaning presentation of who actually gets treatment in eating disorders, and as someone who works in the perinatal world, I don't know many female identifying patients who don't struggle with body image at different points in their life that does disrupt them.
Yeah. Yeah. I think it's probably extremely common. Do you think it's gotten more common?
Yeah. You mean in like light of social media or just like over the years?
Yeah.
I think with social media, we're still learning what the directionality is of like, how does this impact people's body image? So I think the current literature, at least up until like the 2020s, is that there's an association with increased use of social media in terms of like thoughts of dieting, body dissatisfaction, things like that. We don't know if it's causative. So let's say you're on TikTok or Instagram, right? And you're someone who kind of struggles a little bit with anxiety about body image anyway. And then on the algorithm, you see one of those, like, I'm thinking of a TikTok video that's like, did you know you have, I don't remember what it was. They like name a body part that's like bad for some reason every like month. Let's say hip dips, whatever. Everyone always talks about that.
Yeah.
Suddenly you're looking at, let's say you're someone who's already thinks that way or maybe has a genetic predisposition towards body image concerns. And then you see a TikTok that's like, did you know this part of you is bad and ugly actually? And then you pay more attention to that. So the algorithm starts feeding you more of that. And you end up comparing it. And there's this new kind of image in your mind of what is bad about you. So I say all that to say we don't know that there's necessarily a causation in terms of increased frequency in the population. My kind of pet theory is that it takes people who would struggle less, as in it wouldn't disrupt their function, like their body image, and can put them in a situation where suddenly they're receiving a lot more stimuli that can worsen that anxiety and that preoccupation and make them kind of into a clinical level or just make them struggle more with it day to day.
Right. It's like increasing that neural loop. It's like that might be there a little bit, and then it gets bigger and bigger and bigger because you're getting more and more and more exposure to it on social media.
Yeah. Yeah.
When should someone seek therapy for this, and how can therapy help?
Yeah. So I think if we're talking about body image specifically, and when we talk about eating disorders, we can talk a little bit more that if someone has an eating disorder, there is obviously often body image concerns as well. So the treatment for that would be a little different than body image concerns alone without any eating or compulsive exercise behaviors. What we do for body dysmorphic disorder, or when someone should seek help, I think if it sounds very vague, but I often describe to my patients of like, is it getting in your way? So is it making it so every day when you have to get up for work, you're so concerned about what you're wearing to work that it takes you an hour to get dressed every day? And it's exhausting to the point that sometimes you just want to call in sick because you're so worried of how your body or your face or whatever the feature is will look? Is it making it so you can't have the fulfilling type of relationships you want? Is it making it so you'd like to be going out on dates, or you'd like to be, even, if you're not meeting new people, but like you're afraid of how you appear in public with your partner? Is it making that kind of regularly over weeks to months really difficult and painful? And is it getting in the way of work, social, community functioning? Certainly there are people who are high functioning and are like plagued by these thoughts for 7 hours a day. So for anyone who's listening, because I see a lot of female patients with this one, for any of you who are listening who are perfectionists and are like, well, I am doing great at my job and I show up for my kids and my spouse and my family and if you're in a lot of pain throughout it, I would still think to see someone just because you are functioning despite the fact. I mean, you as a physical therapist understand this as well, that there are people who are in just like gobs of pain, but they still show up to every single thing in their life. And then they eventually show up to care after years of living that way. And I think it's similar in psychiatry.
Yeah, absolutely. I think what you just said at the end was going to be my follow-up question. It's like, oh, well, what if you're somebody that just has these thoughts that are annoying and they're pesty and you'd rather them not be there, but you're still doing all the things. I mean, I think that maybe a lot of people can relate to that. Like they're not necessarily canceling everything. They're still showing up to work, but they are having these thoughts. So whether or not you are functioning or it's starting to influence your day-to-day life, what can therapy do? Like describe the transformation that someone could expect with therapy. And I'm sure it takes a long time.
Yeah. So to go back to your idea of like kind of thought loops. So what we do in therapy, the primary option we do for body image work or repetitive kind of, it's true for eating disorders too, is we use cognitive behavioral therapy, but we use a specific subset of it. So for those who aren't as familiar with what cognitive behavioral therapy, or CBT, because that's a mouthful, actually is, it is what it sounds like, which is we often talk about the triangle of CBT, cognitive being thoughts, so your cognitions, behavioral being how those thoughts relate to what you end up doing or avoiding doing. And then emotions is the other part of the triangle. So what is the sensation in your body, and how, when you go into these situations that, in the case of body image concerns, bring up emotions of sadness, anxiety, disgust, anger, frustration, any of that. That is general CBT. Some things that we particularly use for CBT for body image or body dysmorphic disorder depends on where someone is. So let's say there's someone who, one of the core parts of this is, like any anxiety disorder, is going to be something called exposure and response prevention therapy. What that looks like is, let's say the getting ready in the morning example. Let's say they feel like they have to reapply foundation over their skin because they have like some acne scars that they feel they have this preoccupation with, and they have to apply layers and layers of makeup for an hour, even though they kind of know it's not changing how it looks. They still feel like it's not helping. One of the things we would think of that as is there is the emotion that comes up and the cognition. So this is so ugly. I have these scars. People are going to see it and judge me. No one's going to take me seriously at my job. And then like in the emotional body, there's anxiety. Your heart's racing. Maybe you're starting to sweat a little bit. You feel like that sense of your heart dropping, your stomach dropping. And then there's a response to that. So this is the response prevention. The response to that, when we haven't disrupted it, is doing this repetitive behavior of applying makeup over and over again for hours to the point where you're late, or where it gets on your clothes, or where you know it doesn't work and you feel even more frustrated. So what we would do, explaining that process, is we would, one, build up the kind of mindfulness part that is just noticing that that's happening. So I just said all of that very quickly. That often takes weeks of therapy to kind of, these moments that just feel suddenly like you're in them and you don't know what you're doing. It takes a lot of time to kind of draw out those moments for people and see where we can pause it or slow it down or do something differently. And some of that includes asking the story. So the cognition parts outside of specific moments, like, what does it mean if people do think your skin is not perfect? Like, what does that say about you? How do we widen your view of yourself so that you're not just an object that people are looking at, but a human being that's fully alive and moving around in the world and loved for many things, including your perfect or imperfect skin or body.
I love that. And so it sounds like the first step is just becoming aware of these thoughts that seem so true and so sneaky in the background. And I can relate to that because I've gotten so much coaching and therapy over the years where it's like, oh, like I didn't even know that thought was an optional thought that I could have about myself. Or like, I didn't even know that thought was there, but it was affecting how I was feeling and how I was behaving. So I think sometimes for me specifically, having someone else to talk to has been huge because it's sometimes so difficult for me to identify those thoughts that I have bouncing around because they are so ingrained and they are
the
so
water you're swimming in.
Exactly. And so I am such an advocate for therapy for that reason, because you just sometimes have to have somebody else examining your brain to ultimately find it.
Yeah. Yeah. I mean, I think this can be true in a lot of different parts of mental health for people, especially because there is a genetic component of struggling with body image or eating disorders or anxiety disorders. That if you're many women, and Dr. Hilary McBride has a good book on this of women, like mothers, girls, and eating disorders. I am not going to do the mistake my field has done of just blaming mothers for problems, but that there is this one genetic and then environmental part of it's hard to recognize thoughts, feelings, or ways we respond to them as odd if that's what we were taught and that's how it's been around us. And I think that's also where the normative like female body dissatisfaction comes into play too. Like if you're sitting a month before prom at the high school table and everyone's having a salad suddenly for the month before, and I remember doing the Kim Kardashian workout plan in high school. Wild. Yeah, wild. 2-pound weights, ladies, tiny pulses. But it's like if
long lean arms.
If it's odd to anyone around you that you would like, they're not questioning it either. So I think in particular with body image, exercise, and mental health for women, like the culture is not telling you to question it.
Totally. Which is part of the reason why it's probably so difficult to even identify that it's an issue, which is why I'm so happy you're here having this conversation with us. So, you talk about the concept of body as object versus body as self. Tell us what that means and how that relates to exercise.
Yeah. So I think this is a concept that's been in the eating disorder world and also the kind of feminist therapy and feminist canon for a while. So I'm definitely not inventing this. I really like, if anyone's looking for a book on this, the Hilary McBride, again, mentioning, has a book called The Wisdom of Your Body that has a really great chapter on this. But the idea is that from a young age, a lot of girls in particular, though certainly body image and, eating disorders happen to men as well. But many girls are taught to view themselves as objects. So from the outside, what do you look like? How do people perceive you? What does a good girl look like? And what does a pretty girl? What does beauty mean? And that's important as a woman, at least, in the past, for how you're valued. And so you're taught to view yourself from the outside. You're taught to care a lot about what your makeup looks like, if you're dressing the right way or the wrong way, if you're doing any of these things, because they give you value and they can protect you from danger in some ways, right? We constantly now are talking about the idea of like girls and women dressing correctly professionally or in schools. And so when you are taught that, it teaches you to care less about the sensation within your body and the experience within your body, and to more prioritize the limited resource of your attention on what you look like from the outside. I think examples of this in like the workout space are when you're doing a difficult, one of these pulses, and it's like, think about how you're going to look this summer in your bikini. Like, think about these long lines you're going to have, right? You're viewing yourself from the outside, like you're pulling that to mind as motivation. I'm not here to tell anyone to not have aesthetic goals. Like, I think it's people's bodies and their own choice. But I think there's also something that we have to look at and say, okay, well, we need to give people an option. If we're going to say that's their choice, they need to have a full, robust option to not have to view themselves that way. So that is self as object, so viewing from the outside. Self as kind of being, or the body as yourself, is the idea of, let's say, in an exercise class. So I love Evlo. I'm not being paid to say this. I like Evlo because you guys don't ever, one, do the objectification things, which are also often not evidence-based, even for aesthetics.
Wow.
But also it's there are these meditations you do, and then also noticing breathing. Like, we're tuning into sensations within our body, and it's often in a neutral way. And so noticing, like, this is what my bicep feels like when I'm going to failure, like noticing this is what a breath feels like at the end when I'm trying to relax, and noticing tension. From a broader perspective outside of exercise, it looks like being able to have more capacity to, like, if someone has a child and they're postpartum and their body's different, from a meta level, it kind of looks like being able to be more present that first year of life, rather than being as put off by how your body doesn't look how it once did, or you need it to or want it to. Yeah. So those are the kind of two different ways of thinking of it.
Yeah. And I think that during exercise, maybe you can give us some focus points, like when we're exercising. And like you said, in classes, I think some of it's starting from like who you're taking classes from, and are you getting these cues from the external world, but then also internally, like, what can we tell ourselves? Like, what you kind of gave one of, like, instead of thinking about this is how I'm going to look, like, this is what I'm feeling and experiencing now, or give us some examples of how we can apply this while we're exercising.
Yeah. So let's say we're not in an Evlo class, like we're doing some other group class or workout, and we're trying, like, there are cues happening, whatever. I think some of these might look like noticing, like, let's say you've even been doing like a yoga class for a few months, and there's a moment where you notice, like, oh, I can actually do a chaturanga and I never could before. And like staying with that and noticing, like, wow, my body can do this. That's so cool. I learned a skill, right? Which is very different than here's how I look. Another expanded story in exercise might be, wow, I I have a niece and many, many nephews who are under the age of 5. And so sometimes I'll think of, like, wow, I'm going to be able to throw them in the pool and not, like, feel my back hurting or feel like I can't, like, carry them through something at a summer barbecue. Like, this is making I'm going to be so present this summer. How exciting. Another example is, like, I went on like a backpacking trip, and I was like, at the end of it, I was like, wow, I like can walk for 10 miles in a day and like make it through and see all these things. Like, this is truly like what I value and like a life worth living. So I think people exploring their values and what matters to them, and then learning more about the beauty of movement and exercise and embodiment, can help them come up with these stories more naturally, to be able to connect more easily with that than with the old, very over, probably, pattern that's going to recur regardless, especially if you're just thinking about this now, of I'm going to look good or I'm not going to look bad. I feel like is often what women feel. They're not even like, I'm going to look awesome. They're like, I just can't look bad or disgusting in this way society has taught me.
Yeah. It's so sad. It really is. And it's so, like, we hear from members all the time, and we'll hear, like, I'm seeing better results than ever, and they're talking about the physical things that they're seeing, which I think, again, that can have value as well. But when we really get the strong testimonies, it's when people are like, I just went on a 12-mile hike and I had no knee pain and I was so strong. And that's when they go on and on and on and on. And when they get so excited. And that's what I think is so much more. And even for myself, like, I'm like, yes, it's cool to see muscle definition and muscles pop, but like, oh my gosh, when I'm able to lift a heavier weight than I ever thought I could, like,
right,
that is way cooler and way more fulfilling than the visual stimulus of, like, oh, now I'm seeing my muscles pop more.
Yeah. Yeah. I think adding more positive reinforcement for almost anything, like, that isn't just or isn't punishment, also just helps make these habits we want for our brain and our bodies and our longevity easier to keep. I think one thing for me, honestly, anecdotally, personally, was starting to do Evlo and being like, why haven't I been taught any of these things before, to connect to values of, like, oh, I deserve to have access to information and I don't have to exercise. The experiential part of this is huge in terms of people learning. They don't have to give up their connection to movement or exercise or even to aesthetics to have a kinder, more sustainable or gently consistent, as you guys say, experience day to day. And like, I think I want that for all of my friends, all of my patients that out there. That doesn't have to be a punishment session every day.
Well, I wonder if the culture around exercise as punishment kind of stems from some of these underlying body image issues. What do you think about that?
Yeah, I think definitely. I think there's also even a bigger picture in terms of like idea of the control of the body as like a moral good is something that is present in, medicine and culture. It's been around for a long time, ever since the separation of the mind and the body, right? There's the philosophy goes way back to say like the mind is the higher kind of sacred part. The body is the thing you have to control to not break down and die and do, way back like sins, things like that, which we think like, oh, that doesn't matter. I'm just going to this bar class or I'm going to this reformer class. But when you truly go down and look at these body image things, there are these deeper stories and philosophy. I mean, this is part of why I like working in eating disorders is there are these deeper stories there. And so these base assumptions of like being able to control yourself is good. Being able to having the idea that you can control your body and your cravings and your urges and your emotions is one I run into often as a psychiatrist. Is very, very present in everyday life. And it is, I think, still unquestioned. I don't know if that actually answered your question, but I think it's there with the body image stuff as well.
Yeah. Well, one of the things we often hear that people do struggle with when it comes to Evlo is the mindset piece and transitioning from I'm so used to, going as hard as I possibly can and grinding my body into the ground. And now that I'm not, even though I understand the science and even though I understand that less can be more, it's still difficult for me to transition my mindset and feel like I've, quote, done enough. So if someone's in that boat, is this a place where it's like maybe therapy would be a really good place for them to start? Or do you have any recommendations for somebody like that?
I always frustrate my patients by telling them this, which is always just, well, insight is the first step. I would say I would ask if it shows up in other parts of their life too, in terms of like if therapy would be helpful. People who struggle to slow down, I think for some people like that, it can be important to go to therapy and talk about why it feels dangerous or stressful to not be going. Like, is it really hard for you to relax? What does it mean if you're not? Like, what does it mean about your identity and your self-worth if you truly are working out 3 times a week and the other time you can just like scroll on your phone or hang out with your family or do something valuable or not valuable, productive or not productive? So I think it again depends on the amount that it shows up in all parts of their life if therapy would be helpful. I do actually think knowing more about the science is a big part of this, of the antidote to feeling like you have to do that. I personally also think asking people questions around like what things are influencing you in the broadest meaning of that word. Like if you're following a bunch of people online who are showing their 2-hour workouts every day and that they're constantly in a cut and they're constantly up at 5 a.m. and just showing you these snippets that's like a good life is like a life that's super fast and productive. I think sometimes having a media diet where you actually look and say, maybe I don't unfollow these people. Maybe I mute them or don't follow them for a couple weeks and see if I notice how it feels. Or even just like reading or watching long form media instead of scrolling each day and seeing if that impacts how much you think about your body and how you look.
Ooh, I love that. I always feel so much better when I love to like read studies and like literature and stuff like that. And I always feel so much better mentally when I'm doing that versus when I'm just like scrolling. I always feel horrible when I'm scrolling. Like I notice those body image, like it is like, I notice those body image, like things start to come up, compare and despair. It's like, no matter how much work you've done, like it is hard when you're getting that stimulus in your brain all the time. So I love the suggestion of the long form podcasts, reading, things like that.
Well,
Great.
it's also,
Great
you
tip.
have to ask these questions of like, and this is true for people with chronic pain as well. Like it's frustrating. I know when therapists or psychiatrists say this, but like sometimes we're using those things to get away from feelings that we need to feel or talk about or process in relationship. And yeah, I think in terms of the people who are like struggling to slow down or struggling to do less, and then, going online more or seeking out other things to be productive with, it's kind of like, well, your feelings still gonna, there's this quote, I forget who said it originally, but it's like, if you don't deal with your feelings will deal with you.
It's so
And
good.
yeah, unfortunately they will.
Yeah. They will catch up with you totally. And it can be such a numbing behavior of just like scrolling to try to escape these uncomfortable feelings.
Yeah.
So I've dealt with that for sure. I want to go back to postpartum body image, which you just briefly touched on. And you said you work with a lot of postpartum women.
Yes.
Can we talk about, you mentioned how when you're postpartum and you have a new baby, you want to be there and be present for those moments that are so precious, but your body is so different. You physically have gone through something that is, you're in pain, you're recovering, your body physically looks different in a lot of ways.
Mm-hmm.
So do you have some tangible tips of how women can really stay present in that stage of life instead of kind of stewing on the body image piece?
Yeah. I will say everyone has a therapy modality that they pick kind of because it aligns with their views of the world already. And then they learn more in it, whatever, it's a cycle. So I will say my bias is I'm acceptance and commitment therapy. That's my like main bias, and then psychoanalytic. So what I'm going to say is from those lenses primarily, and then from the work with people. I think first of all is go easy on yourself and don't make being present be another thing you have to do, or that needs to be done all the time. I often will have patients come in and kind of say like, I shouldn't even be thinking about this body image stuff. I should be like there with my child. My child's only gonna be like, 3 months, 6 months, 9 months for so long, and I'm missing it. I'm not even there for them. So first they come in and they're already beating themselves up for it. So I'm going to speak a little bit out of both sides of my mouth with this, but I think noting that and not trying to not go in with this harsh view of yourself, which a lot of people have prior to pregnancy and postpartum. And then suddenly like your body is different. Your body has gone through something significant. You're not sleeping. You're maybe breastfeeding. You have all these social things. Your relationship is maybe struggling in the first year postpartum because it's like we're both not sleeping and we're stressed. So I think the first thing is taking a breath metaphorically and noticing that like this is probably a really hard period, and most people don't. I think every time I see my patients in the perinatal clinic, it's like most of you guys are lying to each other. Like a lot of people are struggling with this, whether they're getting mental health care or not. So I think one of the good things about social media has been that people being more open about what postpartum was like for them or what pregnancy is like, because there's so many scripts about being a good mother. So I think concrete things I would say to make it more possible for you to be more present. I think that getting chunks of sleep, this is one of the clinical things we tell people. Concretely, if you have a partner that you're splitting like feeds with, getting chunks of sleep is going to help your mental health more than like you switching every other feed. So like one person's in charge of feeding the baby until 2 and then they sleep. The other person sleeps like 8 to 2 and then is up and does the feeds in between. That is an extremely concrete thing to help with mental health. We talk about this a lot in the perinatal clinic, especially if people struggle with depression or bipolar disorder. So that is something concrete, is if you can anchor the sleep, do that.
Instead of switching off feeds. So like you do one feed, I do the next, you do, and then you're only getting like an hour at a time, maybe.
Yes. Yeah.
Okay. So getting like dedicated chunks of sleep is more impactful to your mental health than getting little chunks more often.
Yeah.
Okay. That's so helpful.
Yeah. That's one concrete thing that I feel like I tell my friends who are not in my clinic. I'm just like, hey, did you know this? Like, so that's one concrete thing for sleep. I'm not a pelvic floor physiotherapist and I'm not an OB. So listen to your doctor, obviously, about exercise, but especially if exercise was important to you, while you were pregnant, before pregnancy, when you are safe or approved to get back to it and have it be prioritized as much as possible slowly in a graded way. So we know that what people doing exercise programs, like most studies have been 3 to 5 times a week, 30 to 60 minutes, mixture of aerobic or resistance training. But in the psychiatric world, we know that that has, for patients with mild to moderate depression and anxiety, it's a little different for more severe ends of the spectrum. But that exercise in that way regularly acts as functionally at the same effect size as like an antidepressant, or almost at the same effect size. So knowing that, and that you are not going to be able to exercise, in the same way, I think is important to consider how someone's feeling a certain way. And also to think about, like, if you need an antidepressant, some people need an anti-anxiety med or an antidepressant, which, by the way, are very safe in pregnancy and in breastfeeding. The general SSRI classes are very well studied. That sometimes we think about that, like, if you're someone who, when you're not exercising, your anxiety is so much higher, and you know this from prior life experience, thinking about that before pregnancy, during pregnancy, and having some mercy on yourself that, like, we are functionally taking away your antidepressant for a few months and we're having you not sleep. So I think getting back to exercise when you can, and having that in mind if you're thinking about fertility, pregnancy, postpartum, and that the exercise doesn't need to look the same. Like, even if you're someone who's like, I ran 10 miles a day or whatever, probably most people aren't doing that, but like walking for 30 minutes outside with your kid 4 times a week, I think people overemphasize what they need to do in terms of getting back again to this like intense exercise schedule, and underappreciate the efficacy of like walking for 30 minutes 4 times a week in terms of how that could help their mental health that has fallen due to not doing their prior intense exercise routine.
Yeah.
That's 3 things.
I think that I have so many thoughts on that, because I think it's like, we tend to be so hard on ourselves, and intellectually, I know for myself, I need to give myself more grace. Like, even at this point in my life, like, I have a 1-year-old and running a business and 6 months pregnant, and I'm hard on myself. And I know that a lot of women can relate to that. And as much as I could like logically say, like, you're doing a lot, like, give yourself some grace, like, try to lower your expectations of yourself. It's so much harder, or it's so much easier said than done. So is that someplace where you're like, okay, you're telling me to give myself grace, but I can't.
Yeah.
So now what?
Now what? I think one thing, like, a lot of people, again, this is something my patients like love and hate that I do, or I'll go, yeah, you know it up here, but you don't know it in like experientially, which is what I mean when I go here. I think like, I also want to acknowledge, like, people go through many different situations around like pregnancy, birth, and postpartum and parenting that are their mental health can be so dependent on resources, privilege, and access to like help and community. And that feeling bad in a situation that would make 99% of the population feel bad is not necessarily a mental illness. But unfortunately, we live in a world where you can see a therapist, and that is a way you can get support. So I just want to acknowledge that as like there's many different ways people experience this period of life that make emotions make sense. If, let's say, someone has access, or they have more access, and they are like, I can't do that. We mentioned earlier with body image, the exposure and response prevention therapy, where it's like, we're going to try, and in that example, it was like, we're going to try you're going to have the emotions come up in anxiety around like the body image stuff with, in that example, their skin. What we would say, we want to do something that's going to make you like 5% uncomfortable, and then resist the urge to correct that emotion. And so in that situation, maybe we would say, why don't you try and putting on only 3 layers of foundation instead of 7? And then we'll work on mindfulness and coping skills to allow the part of the anxiety that exists to be coped with. And over time, we kind of habituate so you can do things that the anxiety or panic made you not able to do. For a person who says, I can't be nicer to myself, or I can't relax, I don't think you curse on this podcast, so I'm not going to curse on the podcast. But often I say to my patients, like, okay, well, can you be 5% less of a witch to yourself? And what would that look like? Like, could you just be less mean? And we laugh, and then we say, okay, what would it be to be less mean? So let's say someone's like, you know, I saw someone online and they got their pink back or whatever the hell, whatever that phrase is.
You can cuss, it's okay.
Yeah.
We're all adults.
Whatever that phrase is, like, that you see on like postpartum and targeted towards people about their like, get your body back programs. Yeah. And so what I think often people will see online is like, here's 3 things to say, like, be nice to yourself, have positive body image, have these positive thoughts about your mothering and postpartum. And I think that makes people have more experiences of failure of like, I can't do that. Now I'm having all these negative thoughts still, and I'm even failing at this being nice to myself. So I think of it as an exposure to say, okay, well, how can we be like 5% less mean to yourself? And so maybe that means not spending a half an hour on your phone looking at that like influencer mom who's doing all like wooden toys that she hand painted and they're living in like a field or something. And you recently, you know, you had anxiety and drank Diet Coke before you breastfed or something, which by the way is fine. But like, you know, it might be like, okay, don't do that thing that is kind of mean and self-punitive. And then we go from there. Like we go little by little until they can be a little bit more neutral towards themselves.
Well, it's almost like a gentle consistency approach with your mental health.
Yeah.
Like it's not going to be solved overnight. And it's okay if even you trying to improve your mental health, just like you try to improve your physical health, isn't A+ every single day. Like the actions that you're taking doesn't have to be A+. It could just be these little actions that compound over time. I know I've seen that with my mental health for sure. Mm-hmm. Like it just takes years, and it takes like just little actions and little transitions, and like going from something that I do that you sounds like you practice as well, as like taking a negative thought and just trying to make it slightly less negative, or just trying to make it neutral. Yeah. Like instead of like, I hate the way my body looks in this outfit, just saying like, I have a body and I'm wearing an outfit. Like it's not positive, but it's a lot less negative, and it makes me feel a lot less crappy than I look terrible in this outfit. So I think that's a great tool for really anyone, not even postpartum women, to use.
Yeah. No, I think it's like, this is part of the conversation of why some people don't love, there's a lot of history and kind of whitewashing of the body positivity movement that I won't get into, but I think clinically it's one of the reasons we don't necessarily use it for all approaches, because it can feel so disingenuous that it doesn't resonate with someone. There's no kind of corrective emotional experience of it. And so they can't access it. And so again, it just feels like another thing that they're not doing right, or that they need to add to their plate.
Yes. The affirmations thing, although I love those affirmations. I think it's a great concept.
I love the idea of affirmation.
Same. I love the idea of affirmations. They have never worked for me. They've just not, like I could tell myself, I could write it on my mirror, write it down every day. And it still is like, yeah, but like, I would love to believe that, but deep down, I really don't believe that at all. And I think that like deep layer of yourself is always going to kind of win. I don't know. That's been my experience. Not a pro. You are.
I think there was a conversation I was having, this is a while ago, I think, in therapy, but the idea of like self-love, though obviously there's like the wellness marketing of it that is like, do all these different behaviors and buy this, that, and the other and make da-da-da. Somehow also it's about anti-aging. I don't know about that. But one of the things that it has become is like, you're going to only have positive feelings and positive regard for yourself. And anyone who has loved any person, whether that's your family or your partner or your best friend, or child, knows that that is not what like love feels and looks like all the time. And it's not that you don't love someone when you feel frustrated because you know them so well that you know their annoying habits, right? Like it is not all positive affirmation. And I think that's a very shallow view of caring about yourself or being connected to yourself. And so often pulling people back to that, their lived experience of what it means to love another person, can help them have a better understanding of what it might mean to be loving towards themselves. And again, less mean. It's often like you might still fight and disagree with yourself, but you will not tell them that they're ugly and don't deserve to be a mom because they like
Yes.
We're on their phone for too long.
Yes. Like the reality of having a human experience is that you have a spectrum of emotions. You don't want to be happy and positive all the time. You don't want to be happy and positive when bad things happen. You don't want to be happy and positive when your kid is like throwing a fit and like, really frustrating you. Like it makes total sense. But I think we have this expectation of ourselves that we should be like that all the time. And if we're not, then we're bad, or there's something wrong with us, or we're not good girls.
I love this. I love this topic. So I'm so happy to be talking about it and also let people hear it, because I don't know, there's like 10. So I've been in the perinatal clinic for 2 years as like my sub concentration in residency. And so most places don't have that. Most psychiatrists do like a month of preconception, but they don't. All my therapy patients have been pregnant women with eating disorders. So I am deeply in this topic, and it's not, people don't have access to correct information about this.
No, they don't. And I don't think doctors, listen, obese is not their fault, but they have so much on their plate. And a lot of women just don't have the awareness that like, oh, I should be talking to somebody about this. And that would really, really help me not only like feel better right now and enjoy this experience more, but like maybe potentially help me heal better, like help with like my stress levels, like help me sleep better. Like it's such a holistic part of your overall health. And in this period of life where you're growing a baby, delivering a baby, like it makes total sense to be prioritized. So I'm really glad that we talked about this. Dr. Margaret, Dr. Duncan, are you Dr. Margaret or Dr. Duncan? Which one do you?
When I see my child patients, I'm Dr. Margaret. When I see adults, I'm Dr. Duncan. So I'm in Massachusetts, so they love that. They think my name is Dr. Duncan Donuts. So it works.
Dr. Duncan Donuts.
It works.
That's phenomenal. Okay, so plug yourself. Where can we find you, follow you, read your stuff, listen to your stuff? Tell us all the things.
Yeah. So I'm on TikTok as Bad Art Every Day, where I write about like lifestyle stuff and kind of talk about mindfulness and mental health. I write longer form about like wellness trends, and like I have a series that's wellness versus PubMed, where I use my free access to research articles to be like, what is going on here? That's on my Substack, which is also Bad Art Every Day. And then I and another psychiatrist have our mental health podcast, which is How to Be Patient, where we talk about exercise and mental health. We recently had a pelvic floor physical therapist on to talk about her book and the connection with sexual health and things like that. So those are the places you can find me, and you'll see me sometimes in the Evelo comments as a member.
Yay. Why the handle Bad Art Every Day?
So I started at intern year. So that was 4 years ago now of residency. And the perfectionist, anxious part of me was like getting too caught up in the end product. And so it was kind of like a glib reminder to myself of like, it's actually not about making one good thing. It's about making something every day and being engaged in like the practice rather than the end product. So very much sounds like gentle consistency, but that's why. And then it stuck, and I still like the reminder every day.
I love it. No, that's awesome. I need to try. I need to pick up some art or something. And I recently picked up cake decorating.
Oh, fun. And
just because I'm like, well, at least I can like eat this. Like a piece of art, I just feel like I have to throw it away. At least I can eat it.
Oh, and it's so fun.
It's so fun to be bad at something.
It is. And it's also, this is my last tip to new like mothers or women who are perfectionists and hard on themselves, is like give themselves something to do that's offline, that they practice giving themselves permission to just like it for the sake of itself without it making them a better person.
Yes. And that's why I picked up the cake decorating, because I was like, I need something that's not work. It's not like it's not about being productive. It's just about like doing something and creating something and then eating it, and it's gone and it's fine.
Well, and what a metaphor, because it's delicious regardless of what it ends up looking like. It's a great thing to have regardless.
Yes, exactly. Well, this was a joy. I cannot wait for part 2. And thank you so much. I know you're so busy, so thank you so much for being here.
Thank you for having me.
Yay. All right, listeners, we will see you all next week. Same time, same place. Bye for now.